Dr. Crystal. We just wrapped up at the backpack fair and I was with Valverde Regional Medical Center. Had my little stand here talking about kids and COVID vaccines. I had a lot of really great questions and I was so happy to meet with y'all today and answer your questions and concerns. We were able to bust some myths today, so I'm really happy about that. One of the first myths we busted is the myth is that kids don't get COVID. Well, kids do get COVID. And I was able to share with you guys today that over 4 million children have gotten COVID since this pandemic started. And almost 20% of the cases last week, new cases of COVID last week, were in children. So kids absolutely do get this. All right, y'all, myth number 2, kids don't spread COVID. Well, that's false. I don't know where that myth came from. Early on, there were some really silly small studies done about kids and maybe they have less virus in the nose. Maybe they're less likely to spread it to others. As a mother of 4 and a pediatrician, I can tell you without a doubt, kids get viruses, all viruses, and kids spread viruses very easily. They bring it back to their households, and more recent studies have proven that that's exactly true with COVID, just the same as it has been for any other virus. RSV, rhinovirus, enterovirus, adenovirus, influenza, kids get it, kids spread it. Okay everyone, myth number 3, kids don't get sick from COVID. Well, it's a blessing that the children have not gotten sick in the same numbers, to the same extent that adults have. But I think the adult numbers, because they're so severe and so catastrophic, have kind of overshadowed the pediatric COVID numbers. And we kind of haven't been paying as much of attention to kids as we have adults because the adult numbers have been so bad. But I think if we pay attention to the numbers, you'll agree with me that kids do get sick from COVID and a significant number of them get sick from COVID. So most of you have probably heard about multi-system inflammatory syndrome in children. More than 4,100 cases of this syndrome have been reported since the pandemic started, and that is likely severely underestimated. For instance, in Texas is reporting about 100 cases of MIS-C, but Texas Children's Hospital alone took care of more than 100 children with this syndrome. So this number is likely far higher than 4,100. This syndrome in particular will land a child in the hospital, and more than half of these children will end up in the ICU because the inflammation is so severe around the heart, they will need special intense medications to help their heart pump strong enough to get the blood to their body. Some of these kids do end up on a ventilator. Not all hospitals are reporting their numbers of children hospitalized specifically with COVID, but of the ones that do, somewhere between 0.1 and 1.9% of child COVID cases will lead to hospitalization. Now that percentage may sound really small, but when you multiply that percentage by 4.2 million cases of COVID in children, you get 4,200 to almost 80,000 child hospitalizations. That's a really significant number of kids that are ending up in the hospital from a vaccine-preventable disease. Okay, so with this Delta surge, more and more children are being hospitalized. In fact, some children's hospitals are reporting that 10% of the children hospitalized there right now are hospitalized due to COVID infections. So that leads me to myth number 4, which is kids don't die from COVID. But unfortunately, kids do die from COVID. Since the pandemic started, 349 children have died from COVID infection. And in comparison, any given flu year, 37 children to 199 children die from the flu. So if this was just your typical flu year, you would see this as frontline news that this is the worst flu year ever for children. Many children have died from COVID. And what's worrisome to me is, per the CDC, 1,311 children have died from either pneumonia, influenza, or COVID. We don't know which one of those. And most people understand influenza has been relatively non-existent during this pandemic. So that only leaves pneumonia and COVID. So there are many more children that are not accounted for that may have died from COVID. Okay, I had a lot of questions about, does the vaccine cause myocarditis? Great question. So let's talk about what myocarditis is. Myocarditis is a level of inflammation specifically of the heart tissue and the heart muscle. And yes, there have been almost 1,200 case reports of someone getting myocarditis after receiving COVID vaccination. Almost all of those reports have been in people ages 30 years and younger. And that's out of more than 35 million people ages 30 years and younger getting the full COVID vaccination, both vaccines. So if you look at 1,200 people reporting cases of myocarditis out of 35 million people, that's an incidence rate of 0.003%. And most of, those cases haven't been truly proven to have been caused by the vaccine. But if they have, that incidence rate and risk is 0.003%. Most of those cases were extremely mild. Some got better with nothing other than time. Some got better with ibuprofen. Very few led to a short hospital stay and then got better. As opposed to viral myocarditis, which COVID absolutely can cause, as many viruses do, and can be devastating to the heart tissue and leave permanent damage to the heart tissue. The Big Ten Conference actually noticed an increase in viral myocarditis after their college athletes, otherwise young and healthy people under the age of 30, were getting myocarditis after getting COVID infection. They actually screened all more than 1,500 of their college athletes that had had COVID infection, and they found an incidence rate of viral myocarditis of 0.3 to 2.3%. So if you look at this study and these numbers in comparison to maybe getting a mild case of myocarditis after vaccination, your chance of getting myocarditis is 100 to 766 times higher after getting COVID infection than getting it after the COVID vaccine. So that leads me to my fifth and final myth, my favorite myth to bust. The vaccine is too risky for my kid. Well, we busted that myth today. The COVID vaccine is safe and it does work for your kid and for us. I like to compare this vaccine to the chickenpox vaccine. Before the chickenpox vaccine came out and was highly distributed in the mid-90s, an average of 4 million children got chickenpox every year. Very similar to the 4 million children that have gotten COVID. It led to thousands of hospitalizations, somewhere between 10 and 13,000 hospitalizations a year. We've already discussed that COVID might be causing many more times children to be hospitalized right now. And chickenpox caused somewhere between 100 and 150 children to die every year. We already know COVID has killed many more children. The chickenpox vaccine works. It has saved hundreds of children's lives every year. It has prevented thousands of hospitalizations every year, and it has prevented many missed school days and work days and pain and suffering because of chickenpox illness. The COVID vaccination does the same thing, and even to a higher extent, because COVID is the war that we're fighting right now. COVID is the infection that's out there that could infect your child, it could infect you, and it is much more likely to do that if you're unvaccinated. So I urge you, if you're 12 years of age and older, get this vaccine. Protect your child with this vaccine, protect yourself with this vaccine. Some of you came to me really disheartened, saying, my kid is 11, my kid is 5, my kid is too young for this vaccine. And my answer to you was, please hold on and be patient. Pfizer has been looking at this vaccine in kids ages 6 months to up to 12 years of age, and their data looks really good. They will be submitting that data and asking for emergency authorization soon. They plan to be able to have that authorization sometime early to midwinter. I hope that it will be even sooner. But until then, the best way to keep our children safe that are too young to be vaccinated will be to wear their mask anytime they're out and about in public, especially at school. Keep their hands clean, and don't send your child to school if they're sick. even if you think it's just their allergies. Stay home until you're well. When you go back to school, wear your mask. If you want this vaccine, we're giving this vaccine in clinic every Friday at noon. Come and see us, come and get it. Tell your friends you've gotten it. And if you have any other questions, reach out to us. I'm happy to answer questions. No child in my book should die from a vaccine-preventable illness.